I'm preparing to enter into pharmacy school, and as I've prepared myself to do this, I've done an extensive amount of research in the field of pharmacy and its role in healthcare. And one of the things that has often caught my attention, and something that I believe a lot of pharmacists should be concerned with, is the fact that pharmacists in healthcare are not considered primary care healthcare providers. Now you may ask yourself, what's primary care? What's provider status for a pharmacist mean? And I'd like to reference an article by a pharmacist named Kathleen Kenny. And her article is titled Provider Status, What It Means to Pharmacy Practice. And I'll just quote it real fast. And she says, consider all patient care services available from pharmacists. Patient education, medical therapy management, comprehensive medication reviews, ongoing medication monitoring, disease management, and prevention and wellness services. These are just a couple things that pharmacists can do for people who come into a pharmacy. Now, not all pharmacies look like a Walgreens or a Walmart. Some have a more personal setting, such as a community clinic or a hospital pharmacy. And the issue here is, the problem with the way things are done right now is that people need to go see doctors for illnesses, for problems they may be having. A physician, a doctor, is a very busy person, and it's very expensive to see a physician. And with his busy schedule, he oftentimes will prescribe, let's say you have a chronic illness, he'll prescribe a chronic prescription. And this person will just repeatedly fill the prescription and have no idea why they're doing so, per se. And in some pharmacies throughout the country, pharmacists have taken upon themselves to educate their patients on what is going on. Why is your prescription not working? Which leads to my next point. Another issue is the fact that the country alone wastes millions of dollars each year for something called the cost of non-adherence. And I'm referencing an article in the American Pharmacists Association website by writer Sonia Collins. And $290 billion cost of non-adherence. And what that is this is what happens when someone goes and gets prescribed a medicine and they take it, but it doesn't work right away. And then they go back to the doctor and say, my prescription's not working. And they get into this cycle of going to the doctor consecutively and spending more money seeing a physician, wasting time there and resources, and trying to figure out what is wrong with that person. When in reality, they could have sat down for a 30-minute briefing with a pharmacist, and the pharmacist could have said, you need to take your medicine for this amount of time for it to start working and for it to be effective with your body and your current situation. The problem with that, the reason that you don't do that at CVS or Walgreens, is number one, time, and number two, it's not in the pay for a salary. A CVS is paying the pharmacist to fill prescriptions and to get as many done as they can. If they set as part-time to go visit with the patient and not able to bill for that half an hour accordingly, then a CVS or Walgreens is going to lose lots of money. And so, to be a primary care provider, a pharmacist would be able to in fact bill insurance well less than a physician for that brief 30-minute briefing of a meeting for that individual patient. A pharmacy is usually a much more community-based operation. I had the opportunity to work in a local pharmacy, it was a community clinic, and people would come in, and this pharmacist would explain as quickly as she could what they needed to do. If she was able to bill, in fact, the patient's insurance, she would be able to effectively help a lot more people at a much more affordable cost than a physician could. And that's an interesting concept for me to think about. There's definitely a big push in the country right now by pharmacists and healthcare providers who are on board with this movement amongst pharmacists to become providers, so they can have just a better cycle of patients getting care. You see similar care in physician's assistants and nurse practitioners, and but that's getting off subject for this topic. Now I'd like to talk about an interesting circumstance in the state of Washington, and in an article from June 2014 by Diana Yap, writing for the American Pharmacists Association. The state of Washington plans to implement what's called Medicaid Managed Care for 2015. And this is a giant leap forward for pharmacists, because where a lot of the times pharmacists would do these duties out of the goodness of their heart, or they would have extra time in educating and treating patients with their vast knowledge of medications and the body chemistry that takes place when these medications are involved. In Washington, for the year of 2015, they are now able to bill, and Washington hopefully will be seeing the results of this throughout the year and be able to evaluate what has been going on. And like I said previously, the idea here is to be able to have a more efficient way to treat patients and make it a lot more affordable. So it's not the pharmacist is not working in contention against the physician. There's no competition there. It's been used across the country in many hospitals for educational purposes, to see a doctor, a pharmacist, a nurse practitioner, a physician assistant, all working together on what's called a healthcare team, and they'll work together to solve problems. And it's just being the person would go see their physician for the initial diagnosis, go to the pharmacist, and then see the pharmacist repeatedly after that at a much cheaper cost for the insurance companies or the government or Medicaid or Obamacare, and the pharmacist would be properly reimbursed for their services. And so pharmacists need to be able to have provider status in order for this to take part. The benefits, like I said, include more effective ways of treating patients, lowered healthcare costs, lower losses for the government, and for insurances. And as soon as this can happen, health will get better, and there will be a little bit more money to be put towards other things. Thank you.